Hi there, my name is Jared Hiscox. Today I'll be using the 5 R's reflective model to talk to you about clinical reasoning and decision making in paramedicine, and also reflect on how this affects my future as a paramedic. Clinical reasoning and decision making can be defined as thinking through the various aspects of patient care to arrive at a reasonable decision regarding the prevention, diagnosis, or treatment of a clinical problem in a patient. In the literature, the terms clinical reasoning, decision making, problem solving, and critical thinking are often used interchangeably. Essentially, clinical reasoning is the way a clinician thinks about the problems they deal with in a clinical practice. It involves clinical judgments, deciding what is wrong with a patient, and clinical decision making, deciding what to do. Failure to exercise sound clinical reasoning and decision making is one of the leading causes of adverse events and clinical error. This highlights the importance of clinical reasoning and why its development is as necessary in paramedics to achieve optimal patient care and outcomes. Many studies have identified that effective clinical reasoning and decision making is a skill gained over time and is essential to the everyday practice of health professionals. While there is limited research in paramedicine that looks at the correlation between clinical experience and the ability to make clinical decisions, there are frameworks from other professions such as emergency nursing that have examined this. Benner's theory supports the link between experience and effective application of clinical decision making, but also acknowledges that education, intuition, and environmental factors are contributing to a person's ability to form clinical decisions. Benner's novice to expert model identifies the symbiotic growth that occurs between clinical experience and a clinician's ability to make decisions. The 5 stages are novice, less than 6 months, advanced beginner, 6 to 12 months, competent, 1 to 3 years, proficient, 4 to 5 years, and expert, greater than 5 years. For me, the idea of transitioning into the role of graduate paramedic is exciting and daunting. From my time on road, I believe that my clinical knowledge is at an appropriate standard. However, my ability to make confident clinical decisions still needs some improvement, especially in complicated and stressful situations. However, this is not uncommon, and many paramedic students have the same issues. I believe that this is largely due to the fact that clinical experience and reasoning is not a skill that can be taught at university, but is an important ability that is developed over time and exposure in the job. I have been in multiple situations where not all the information required to make an informed decision is known or available. I've also been in situations where my ability to make decisions has felt impaired by stress and time pressures. Ambulatory consultations are recognized as stressful situations, and a study by Porter et al. 2013 looked at the relationship between stress, communication, and clinical reasoning. The study found that stress had a negative impact on both a person's communication skills and decision-making process. From my experience on clinical placements, I believe that a paramedic's decision-making process is continually evolving throughout a case. With the introduction of new factors and variables, such as patients' vital signs or stresses, it is important that paramedics are flexible and can adapt to the situations. Examples of factors affecting a paramedic's clinical decision-making process are missing or incomplete information, level of knowledge or experience, uncertain environment, competing goals, time pressures, personal stress, multiple people working together, and organizational goals. From my own experience, these are all significant factors that impacted on my own and other paramedics' clinical reasoning and decision-making abilities. It is important for paramedic students to identify the significance that clinical reasoning has in their future practice, as it directly correlates with patient safety and outcomes. In fact, the predominant factor for adverse events, near misses, and clinical errors is a paramedic's decision-making. The ability to provide sound judgment and patient safety is also directly attributed to a paramedic's clinical reasoning skills and experience. I believe clinical reasoning is an important skill that all student paramedics must develop to practice safely, as clinical errors have been identified as a factor in over 57% of adverse events in healthcare. I believe this highlights the importance that clinical reasoning has for future paramedics such as myself, as it leads to better patient outcomes and minimizes adverse events. Through my time at university, I've been able to learn how to make appropriate clinical decisions. Students such as myself have learnt this through various educational tools such as placements, scenarios, examining clinical cases, and reflection. The main point of reference that has guided my own clinical decision-making processes are clinical practice guidelines. All Australian ambulance services have clinical practice guidelines, which provide advice on best practice and are designed to guide a paramedic's clinical decision-making abilities. As paramedics, we are now attending a growing range of patient demographics and illnesses. The greater level of autonomy that accompanies the growing scope of practice leads to an increased risk to patient safety due to the increased demands on clinical judgment and decision-making. In a study by Bingham et al. 2011, the use of protocols and guidelines were recognised as highly important for high-level patient care. However, some paramedics noted that they felt they had been penalised for exercising good clinical judgment under the current model of protocol-driven care. The use of algorithms such as the primary and secondary survey have allowed me to perform continually in a methodical and comprehensive manner and guided my decision-making processes. Most ambulance services will recommend the use of these algorithmic approaches, with the primary survey identifying immediate life-threatening conditions and the secondary survey gathering pertinent history, vital signs, and cues that lead to a diagnostic decision. These algorithms are helpful for students to easily identify abnormalities and guide their decision-making process, rather than solely relying on their experience or understanding of the situation. A leading theory that explains how clinicians process information and make decisions is the dual process theory. The dual process theory suggests that decisions are made using one of two thinking systems. System 1 is rapid and subconscious, and is often referred to as intuitive or experiential thinking. System 2 is conscious and deliberate, and is often referred to as rational thinking. The table shown indicates some of the key differences between the two processes. System 1 is more commonly used by paramedics with experience and is generally applied with little consciousness, which can be helpful in high-pressure situations. Clinical decisions that are more complex in nature are handled by System 2. However, continued and repeated exposure to a specific patient presentation provokes the clinician to become more automatic in nature and thus refers more to System 1 for decision-making processes. A graduate paramedic will be more reliant on thinking System 2, while a senior paramedic with many years of on-road experience will refer to thinking System 1. System 1, according to Jensen 2010, is still highly prone to error. This shows that paramedics of all experience levels must exercise appropriate clinical reasoning to avoid clinical errors. There are 7 main clinical thinking strategies used in paramedicine, and each one will fit into either System 1 or System 2 thinking strategies. The following table lists these strategies and a description of each one. They are event-driven, intuition, pattern recognition, exhaustive, hypothetic deductive, algorithmic, and rule out worst case scenario. A study by Woodford 2015 highlights the importance of intuition in paramedic practice. Intuition uses System 1 and relies on experience to match decisions that it has made in the past. This process allows paramedics to identify similarities in patient presentations and relate it to previous encounters, allowing the paramedic to make rapid, instinctive decisions, which are helpful in stressful situations. Intuition cannot be taught, but it comes with experience, and it highlights the importance that experience has in paramedicine and a paramedic's clinical decision-making abilities. A study by Jensen, Croskery, and Travers 2011 looked at paramedics' consensus on the most important instances of clinical decision-making during high-acuity emergencies. The aim of the study was for Canadian emergency medical service experts to achieve consensus on the most important decisions paramedics make during a typical emergency response regarding patient safety and clinical outcomes. As you can see from these tables, some of the examples are identifying life-threatening trauma, starting CPR, early adrenaline for asthma, and decisions to defibrillate, just to name a few. But all the topics on this list were agreed to be of the most importance to a paramedic's clinical decision-making. Identifying key decisions in paramedical practice, such as these, are important to help guide future education and improve clinical decision-making training. With diagnostic and clinical errors being continually identified in various paramedic studies, such as these ones listed, it highlights the importance that clinical reasoning and decision-making has in the future of paramedicine to produce optimal patient care and outcomes. Clinical reasoning should not be viewed as a linear process, but instead should be conceptualized as a linked cycle of clinical findings. A visual representation of this is the clinical reasoning cycle, which can be seen here. The clinical reasoning cycle requires healthcare professionals to examine and discuss the steps in a clockwise direction to facilitate decision making, enabling the clear formulation of a care plan. Students or graduates may move slower or miss cues and may have to go back to a previous part of this cycle, whereas veterans will move methodically through this cycle and retrieve the information that is necessary for them to make an informed clinical decision. The clinical reasoning cycle is a visual tool that can help paramedics to identify areas that they need to improve on. Approaches to teaching clinical decision making involves a wide range of strategies rather than just one best practice approach. Strategies include clinical examples from actual cases, clinical placements, reflections, and simulation and role-playing. A tool that is used in nursing to help students develop clinical reasoning skills is the Think Aloud process. This involves students working through scenarios that challenge them and then pausing every time an intervention or decision is being applied, then talking about that decision and its possible alternatives. This also promotes students to think about their decisions, as well as offering alternative thinking strategies. This increases their ability to tap into System 2, which makes decisions based on learnt knowledge and makes a well thought out decision. Moving forward, I believe that the application and development of appropriate clinical reasoning is required to help reduce the risk of adverse events and clinical errors in my future practice. Research such as the Delphi study conducted by Jensen, Croskery and Travers 2011 are important to help future paramedics such as myself to identify important clinical decisions. The clinical decisions highlighted to be of significant importance should guide the focus of mine and other future paramedics' education and training to help improve patient outcomes and minimize clinical errors. Training in these targeted clinical decision-making areas will help myself and future paramedics to develop new thinking strategies. It will also promote the use of both System 1 and System 2 thinking strategies. I believe most paramedics will already be using tools like the clinical reasoning cycle in their practice without even realizing it. From a combination of primary and secondary survey, clinical knowledge, clinical practice guidelines, and interacting and talking to patients. However, this cycle gives a visual representations of students' clinical reasoning and helps identify areas in the cycle where students may need to improve their clinical reasoning abilities. Applying this to future practice will help prevent missing diagnostic information, cues, and vital information necessary to make clinical decisions. I believe it is important to understand that a paramedic's clinical reasoning ability is developed over time with exposure and experience. This has helped me to acknowledge that mastering clinical reasoning will occur slowly throughout my career. Similarly, it is important for us as graduate paramedics to recognize this and be proactive in our own development. Clinical reasoning and decision making is important to my future practice as a paramedic, as it leads to improved patient safety and clinical outcomes. I recognize that clinical reasoning doesn't occur spontaneously, but we as students must continually employ a combination of strategies to develop our clinical reasoning, including placements, scenarios, examining cases, and reflecting on our practice continually. Implementing learning strategies such as the Think Aloud process mentioned earlier is also an effective way to develop clinical reasoning skills. Clinical practice guidelines should not be discounted and should also be used to help guide a paramedic's clinical decision-making process. I believe that implementing these strategies will help me to improve my clinical reasoning and decision-making ability throughout my career as a paramedic. Thank you for taking the time to watch my video. I hope this has answered any questions that you've had on clinical reasoning and decision-making in paramedicine. Bye.